Cultural competence, to me, is developing an appreciation and respect for all those who differ from ourselves. My definition of cultural competence comes from the understanding that the individuals who walk through the office doors are coming from all different walks of life and are culturally diverse.
It entails appreciation, awareness, respect. We always talk about the differences, but we also have similarities between cultures. So I think that cultural competence looks at similarities and differences.
It begins with self-awareness. It begins with understanding, who you are as an individual, what your view of the world is, what your view of everyone else around you is. Specific experiences, shape us, and we need to understand how those experiences shape our outlook.
It's almost like the opposite of ethnocentric. In other words, be able to see the differences in other people. And then when you see that differences, trying to find out what are those, where do those differences come from?
Culture can be anything from race, ethnicity, gender, sexual orientation, any of that. So it's important as physical therapists that we understand cultural competence because we deal with a lot of different people.
It's not something that we achieve by going to one course or by going to one seminar. I think it's a lifelong process of engaging with people from different backgrounds and different experiences.
You're developing skills as you're introduced outside of your core, your family values. And with that comes, I think, ability to become proficient, the ability to ask difficult questions from different cultures, ability to kind of get into a different role as yourself. You have your own culture, but also kind of project into their culture so you can actually be effective and provide that safe and competent care.
You never reach a point where you're completely competent, but it's more of a goal to strive for, to be as competent as we possibly can by learning more about each other, learning more about yourself, learning more about the individuals who we work with. And that's part of the reason why it's so important is because we work with a variety of different individuals. We work with people of different backgrounds, different ethnicities, different races, different geographical regions. And so it's important for us to understand where they're coming from, what they bring to the table in terms of each interaction, because that's going to affect their ability to participate in physical therapy or with a physical therapist.
Our patients need to trust us that we have the knowledge and skills, but I think it goes beyond that, and that they need to trust us to have their best interests in mind. And I think part of that is understanding what their environment is, what their beliefs are, and how invested they can be or will be in participation in their treatment.
If you don't even know where a person is coming from, how can you meet them halfway? And therapy is all about meeting that person halfway, because therapy is a dual thing. So it's not just you doing to the patient, it's the patient actually doing things for themselves, but needing your expertise to be able to do that.
The ability to kind of take the role of the patient or the caregiver or the client, I think you're going to do better than just kind of focusing on your goals, whatever the goal for therapy session was. I think you'll be more successful, as well as the patients will be more motivated to succeed.